Recording stopped. Recording in progress.
We're going to call to order our District Board of Health meeting for Thursday, October 24th, beginning at 1:02 p.m. Sorry, we're 2 minutes off. And I'm asking for roll call.
Chair Dare,
Here.
Board Member Brown.
Here.
Dr. Danko she was going to join online. I haven't seen her join yet. We'll call her absent. Board Member Clacking is also not online. We'll call him absent unless he joins. Board Member Garcia.
She is here.
She is here. She's online.
Mary Luz, can you say hello? You're muted right now. One moment, we're doing our thing, but I think it still shows you're muted, Miss Garcia. We were muted? Oh, okay. Hello, we've started the meeting. We just said, is Miss Marluz Garcia here?
Yes, I can hear you now. Thank you.
Hola, ¿cómo estás? So, she is here.
Vice Chair Reese.
Here.
Board Member Driscoll. Here. We have a quorum.
Very good. Would you stand with me for the Pledge of Allegiance? And we're going to put Mr. Driscoll to work, and would you lead us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we are looking for an approval of the agenda. Does anybody have any question on it, or would we like a motion?
Are there any changes, Mr. Chair?
There's going to be a change to when we come to consent items. There'll be one pulled. Do I need to do that? Can we just get the consent items and do that?
Let's pull it now. and then we
Okay,
can approve the agenda.
definitely. Thank you. We're going to go ahead and pull item 7B2 under consent items.
Okay, I'll move to approve the agenda as posted with the removal of the consent identified item that you,
7B2.
7B2.
Thank you. I have a first. Do I have a second? Any more conversation? Seeing none, all in favor?
Aye.
Any opposed? That passes unanimously. Thank you very much. We're going to move into recognitions, and we want to start by welcoming Steve Driscoll as our newest board member from the City of Sparks. I do have an official oath of office here from the City of Sparks, so I'm going to hand that off to you here when we come down to take a picture. But we want to welcome you. I can just say that I've known Steve Driscoll for many years. When I first got in office, he was our city manager for the City of Sparks. So I'm excited to have him here, and he brings a lot of knowledge. Would you like to say anything really quickly?
Mr. Chair, just I appreciate the mayor asking me to help, and this is a board that I have some experience with. It's been a while. I've been quietly retired for a little bit. I'm looking forward to stepping back in and helping wherever I can and working through the issues that this board specifically works on, which is a vast array of things that we deal with on behalf of the people of Washoe County.
So officially, just so people know, so welcome. He is our non-elected City of Sparks appointee and how that works, but we appreciate you being here. And he serves for 10 years. No, just kidding. He has a 2-year term. So we have new hires. I'm going to hand that off to Dr. Kingsley.
Great, thank you. Starting out with, we're going to begin with new hires and go ahead and recognize Jim English, if you want to go ahead and come up and introduce one of our new hires.
Good afternoon, Chair Dare and members of the board. James English, Environmental Health Specialist Supervisor for the record. I'm here today to introduce Milagros Carreno Olivier She goes by the name Millie. She comes to us with a tremendous amount of experience from the Tahoe Truckee Unified School District, where she's administrative secretary in adult education. She also worked with Truckee Meadows Community College as a web college associate. She has a vast experience in software and interpersonal and public communication skills and the implementation of software, which will be very useful in environmental health. She also has a lot of experience in TS support and budgeting. Furthermore, she is a certified interpreter and translator in Spanish, which I think the entire health district will be taking advantage of in the future. So I'm very excited to have her. She's a resident of Reno, and we welcomed her on this week, and that's pretty much got it.
Welcome
Great.
very much.
Welcome, Millie.
We're glad you're here. We're going to take a picture together, so you're beginning that in just a moment, okay?
Great. Moving on to recognition for years of service. Jesse Latchaw, Environmental Health Specialist, 5 years of service. Woohoo, thank you. Francisco Vega, Air Quality Management Division Director,
Good
5
job.
years.
5
Thank
years.
you. Woohoo. And Danica Williams, Epidemiologist, also 5 years.
Very good.
Woohoo. Thank you. And then moving on to resignations, recognizing Sarah Smith, Emergency Medical Services Coordinator. And then Health Heroes, Maria Magana for Adaptability, Inclusivity, and Compassion. Geraldine Diavila for Adaptability, Compassion, Inclusivity, and Trustworthiness. Irene Dominguez for Compassion, Inclusivity. Liliana Wilbert for Compassion and Collaboration. Jordan Marchi for Adaptability, Collaboration, and Compassion, and Jim English for Adaptability, Collaboration, and Trustworthiness. So thank you all, and we'll shortly have you come up and take a picture with that, but thank you very much for those being such a great and participation in Health Heroes for our community. And before that, let's go ahead and turn it over to Dare for a proclamation.
I'm actually going to hand it over to Mr. Brown. Do you mind? You want to go down there and read it? Yeah. This proclamation we will have possible action on, but this is for Crash Responder Safety Week. So you know a little bit about that, sir, I think?
Yeah. Thank you. So the proclamation reads, whereas law enforcement officers, firefighters, emergency medical personnel, road maintenance crews, public safe service utility workers, and tow operators place themselves in danger every time they work within inches of vehicles traveling at highway speeds to conduct valuable, life-saving operations in adverse weather conditions. And whereas it is imperative that we promote safer incident scenes through public education and awareness to protect all responders as they courageously work to clear incidents. And whereas Crash Responder Safety Week serves as an opportunity for the Department of Public Safety, Nevada Highway Patrol Division, the Nevada Department of Transportation, and other first responder agencies to participate in coordinated efforts to educate the public and bring awareness to first responder safety, and to promote effective traffic incident management strategies and training for first responders. And whereas Northern Nevada Public Health reminds drivers of the Move Over Law, which states, if possible, drive in a lane that is not adjacent to the lane where the traffic incident is located, unless roadway, traffic, weather, or other conditions make doing so unsafe or impossible. And whereas, according to the National Highway Traffic Safety Administration, less than 30% of Americans are aware of move-over laws and fail to abide by them. And whereas, Nevada is committed to the effective traffic incident response and management through collaboration and training, which reduces the duration and impacts of traffic incidents and improves safety to motorists, crash victims, and emergency responders. And whereas over 1,500 first responders have participated in the Nevada Traffic Incident Management Coalition efforts through the state since 2014. And 79% of all first responders in Nevada have received traffic incident management training. And whereas, during Crash Responder Week, the state of Nevada remembers and honors those national first responders who lost their lives in 2023. 14 law enforcement, 8 fire EMS, 20 tow operators, and 3 DOT SSP for a total of 45 first responders. Proclaimed by the Northern Nevada Public Health District of Public Board of Health, that the week of November 18th through the 22nd, 2024 is Crash Responder Safety Week with the theme, Protecting Those Who Protect You, adopted this 24th day of October, 2024.
Any comments before we go to a motion? Anybody? Okay, very good. Obviously, we're here saying thank you. I think our proclamation says all that we want to say. And would you like to make a motion, sir?
Make a motion, we accept the proclamation.
Do I have a second?
Second.
I have a first and second. Any more discussion? Seeing none, all in favor?
Aye.
Any opposed? I don't think so. Very good. Congratulations. Come on up, Andrew Asp.
I'll be presenting this proclamation back to the Traffic Incident Management Coalition, of which several individuals in this audience are members of here. So just thank them for all the work they do and keep everyone safe.
Well, big thank you to everyone. I have two more for you. And if you would come down so we can take a picture with whoever that extra people you have, that'd be wonderful. So let's go ahead and go down and take our pictures.
All right, here we go. 3, 2, 1. Got it?
Thank you. Appreciate it. Okay, is this motion still on? Do you want me to hit this button? I just want to make sure what we're on. I didn't push the button. That's for the proclamation. It just says motion by Member Brown, seconded by Reese, but the second doesn't show. We'll just continue. Okay. Very good. I'm going to really mess you up because we're moving on to public comment.
All public comment is limited to 3 minutes per person and should be addressed to the Board of Health as a whole, not an individual. With the exception of the public comment agenda items, comments will be heard for items labeled for possible action and should be specific to the item being considered by the board. The District Board of Health conducts the business of Northern Nevada Public Health and its citizens during its meetings. The presiding officer may order the removal of any person whose statement or other conduct disrupts the orderly, efficient, or safe conduct of the meeting. Warnings against disruptive comments or behavior may or may not be given prior to removal. The viewpoint of a speaker will not be restricted, but reasonable restrictions may be imposed upon the time, place, and manner of speech. Irrelevant and unduly repetitious statements and personal attacks which antagonize or incite others are examples of speech that may be reasonably limited. We have one public comment. Catherine Yarte.
Come on down. Welcome, Catherine.
Forgive me for having to read.
Oh, you're good.
Looking up here. Thank you, everyone. My name is Catherine Yarte, and I own and operate Team Yarte Horsemanship with my talented husband, Dan. To begin, I would like to make clear that Team Yarte Horsemanship is a well-established state-licensed business. We have been in operation at our present location in Rancho Haven since 2016. Our special use permit, WSUP 23-0034, was approved unanimously by the Board of Adjustments in December of 2023, and our Washoe County business license application, W000042A-APP-2024, has been in progress ever since. The SUP invokes commercial codes for permanent bathroom facilities and commercial septic systems to be installed on private property. While larger operations that meet specific requirements, such as a certain number of visitors per day or week, may need these facilities, it is outrageous to ask of a small home-based business with limited traffic and little public usage. We generate so little traffic that a traffic study was not required and have so few visitors that we do not meet the threshold to qualify as a public water system. And yet we are still required to install a permanent restroom with commercial septic on our private property in order to comply with Northern Nevada Public Health codes. Despite having an average of just 5 visitors per week on an appointment-only basis and already providing an ADA-compliant portable restroom that is professionally serviced weekly. These standards are arduous and burdensome to us as equine business owners since our scope and operations align with home-based business in every way except that horses are involved. The number of horses in our care has no bearing whatsoever on tangible impacts to our community or environment as a business. The number of horses we house doesn't affect the number of visitors to our home, and it doesn't change the fact that the primary use of this property is a single-family residence. We have received passionate support from our neighbors who adamantly oppose the commercial requirements while valuing our place in the community. The fact that we are designated and taxed as a home-based business by the Washoe County Assessor's Office but cannot attain a business license as a home-based business is a testament to the flaws in the current code that need to be addressed. Addressing this discrepancy and acknowledging the minimal impact and small scale of the average equestrian operation will not only eliminate wasted time and resources for the county and Northern Nevada Public Health employees, but also encourage more small equine business owners to operate their business in compliance with Washoe County. In closing, I would welcome the opportunity to meet with you and discuss alternative solutions to allow small home-based equine businesses to operate within regulations and allow us to continue providing educational services in a safe and natural environment to the equestrian community. Thank you once again for your time and consideration.
Thank you, Catherine.
Catherine, if you'll meet with my staff in the back, Mr. Hodge will get you in contact with me so we can make time to meet.
Thank you, thank you.
Chair, for the record, Dr. Danko signed on to the meeting at 1:17.
Thank you for that. Okay, we are moving on to consent items. We want to remind you that we did pull 7B2, and I'm looking for a motion to accept or pull something if they need to be
Move to
pulled.
approve the consent items.
I have a motion. Do I have a second? I have a first and a second. Any more discussion? See none, all approved? All in favor?
Aye.
Any
Aye.
opposed?
Aye.
All, that passes unanimously. That aye was not opposed, right? It came late. Okay, we're looking now to come down, and we have our presentation. Actually, we're recommended for the board, recommendation for the board to uphold air pollution control. Is that we're on? Number 8? Down to 10? Okay. Presentation and update report of Hexagon Unified Computer Aided Dispatch and Records Management Suite Software Replacement Project. And I have Cody Shadle. He's the City of Reno Director of Public Safety Dispatch, correct?
That is correct.
We have
Thank
the
you.
right
Good morning.
Cody Shadle.
Actually, good afternoon now. For some on this board, my name is Cody Shadle. I'm the Director for Reno Public Safety Dispatch. I'm also representative of our Hexagon project as one of the 4 agency coordinators who are assigned project management duties on this project. I think I just used project several times. Apologize for that. Some of you on this board have already heard this presentation multiple times, so bear with me. And for some of you, it'll be new. Right off the bat, my presentation does show August. It is October, so excuse that small difference there. So what I would like to do is kind of orient you to this project, talk about how did we get here, what's a little bit of the background so we can orient the conversation a little bit. I want to go over some key successes, what are those activities we've already accomplished this far into it, talk about how we're meeting some of the regional goals and ideas of what we're doing, and then also give you an idea of how much longer do we have in the project and what's our timeline moving forward. So if I'm going back to the original, the genesis of this project or the beginning of it, we started this in November of 2019 when we originally started to explore the need to replace our current computer-aided dispatch and law enforcement records systems. Now, these are the systems that are currently in place for Reno, Washoe, and Sparks. It's already a regionally operated system, but it doesn't include all of our regional partners. At that time, we brought in an external consultant to help us through the RFQ process and then initiate our RFP process. That all concluded roughly in 2023. And in the middle of that, we also embarked on a regionalization project. Now, if some of you may have been involved or some of the bodies represented by this board were involved in the scope of the regionalization project was to identify emergency medical service and fire service and dispatch service opportunities for improvement. So through that workshop, we're actually able to gain some recommendations to say we need to expand this project, this CAD project, and include some of those partners that weren't originally involved, including REMSA and Truckee Meadows Fire at the time. As we brought them onto the project, we were able to say, we were able to final select our vendor and move forward into establishing a contract and then creating a governance. We knew that this was going to be a huge endeavor. At the end of this, we have about 17 user agencies who are represented in our regional project. So we thought we needed to have some kind of governance structure that allowed people to participate or allowed an agency's voice and the ability to participate moving forward, as well as maintaining the structure and sustainability of our system. So that's where the governance and agreement came into place. Out of governance, we did create 3 public boards, because who loves nothing more than an additional public board? But it does give us transparency, and again, it gives us that voice across all of these large agencies who want to make sure that their needs of their constituents are met. So we've created a manager's board to provide direct oversight. We created an executive board that provides operational guidelines. They establish kind of the administrative manuals and some of the rules and guidelines that will operate the system and make sure that we're doing it fiscally and responsibly for the public. And then we also created a change advisory board that just allows our subject matter experts to come in and make sure that new things, new integrations, new changes are managed well and they don't put the system at large at risk, or we make sure that any one entity isn't taking undue risk. As mentioned, we did select a single system. We unanimously selected Hexagon and their on-call dispatch and on-call records platform. I'll try to focus more on the dispatch side since records has more to do with law enforcement. what we've accomplished out of this so far, so this project actually began implementation back in January. So since then, effective in January, we're able to install our hardware and begin our software installations. Between January and March, we started doing our initial system build. That's just putting all of that data and information into the system and making sure that it's ready for us to start configuring and making it our own. Starting in March and all the way even up until last week, we're still working on configuration, and that's basically making sure that the individual needs of every agency and user partner are met. And then the other part that we've started is our third-party integrations. We have a lot of solutions that are going on top of this CAD system that we want to be integrated, because what we've found and what we've done for years is that our dispatchers do a lot of work. They are fabulous at what they do. They do a great job, but they have a lot of solutions that they have to operate in and out of. And as you can imagine, even just in a daily life, when going between your email and maybe your payroll system and maybe this system or that system, it can be a challenge. Well, it's the same for our dispatchers, except for they're trying to do it in a much truncated time frame. They're trying to get information immediately. They're trying to give help and service immediately. So one of the main goals of this project was to bring as many of those third-party platforms or those outside integrations into a single environment that could improve the workflow of our dispatchers and our responder agencies. So why is this important? Basically, it being a regional project allows us to make better business practice changes. It allows us to look at our workflows and say, how can we improve the system at large? One of the highlights that came out of our regionalization workshop was defining that our customers' expectations are not necessarily being met through our public safety systems. They have an expectation that matches the private industry, things like Uber. I can see where my delivery is coming from. The ETA is very consistent with what it tells me, and it's very transparent and open to the public. Well, they expect that from our public service because that's what they experience in their personal lives. So how do we meet that expectation, or how do we get closer to meeting that expectation? Well, some of the things were common language, and something that this board might be interested in is we have response agencies and we produce data and reports. And we want to make sure that when we produce those reports, that when I say that we're meeting service levels at the city of Reno, we want to make sure that when Spark says we're meeting service levels, that says the same thing and we're using the same metrics to say that we're meeting those service levels. So coming to a common language can be helpful in that space. It's also helpful to know that when the city of Reno or Washoe says that we're responding to a chest pains call, that REMSA is also saying that they're responding to a chest pains call, and that means the same thing to both of us. Now, chest pain is obviously just an example, but we want to make sure that we're talking in the same language so that we can provide service in the same way. So we're achieving those things now. By putting these groups, this large implementation structure together, and having these groups build this project together, they're able to just resolve naturally some of these issues that we've encountered for a long time. We've also been able to start building integrated responses. So in the past, you've heard about closest resource. You've heard about how do we make sure that our mutual and automatic aid agreements are met in a meaningful way. Well, in the new system and bringing everybody onto the same platform, we can start to look at those responses instead of saying, this is a City of Reno call, here's all the City of Reno assets that you might get or resources. We can start to say, okay, well, this call might be in the City of Reno, but what are the best resources within a proximal radius or within the closest distance of this call? Now, there's agreements and other things that come between actually putting those things into production, but we can start building it now to let the system tell us what we can accomplish in the future. My favorite thing is automation. How many opportunities do we have to automate decision making? So any opportunity that we have to eliminate a manual process or a decision is just an advantage in the system. One example would be a dispatcher might enter a call for service because there's a medical call in the city of Reno, or it's in a bordering area. And the city of Reno and Washoe and Truckee Meadows both need to respond to this call. In the current system, if they both need to go, there might be phone calls to coordinate that response. There might be multiple calls for service in different CAD systems. What we'd like to get to and what we want to build is that one call comes in, one call is entered, it creates multiple responses from multiple agencies, and everyone's getting the same information at the same time. That's just one example. And we have a lot of automation that we're able to put into this system. Again, regional processes kind of talks about how do we look at the system as a whole? How do we make decisions, and how do we build workflows that meets the regional need and not just our own individual entities' needs? So that's something that we've been evaluating as we go. And then lastly is information access. It is vital that we provide public safety, and more so than that, officer safety information across the system. And I say officer, I apologize, it's responder safety information. At the end of the day, whoever's talking to that caller is the closest point to get scene safety information to whoever's responding. By putting everybody into the same system, we can now have real-time information. We don't have to wait for a phone call to tell us that a person might have a gun or that there's some other scene safety risk. It can be available to all dispatchers at the same time, which means it can be available to all responders at the same time through their MDCs and through those mobile data terminals. Sorry. So that's everything that we've already been working on, everything we've already been doing since January of this year. So where we're at is we're still completing configuration. We expect to be in this phase until January, approximately January of next year. We will then shift over into testing, which is just testing the system, making sure that it works in the way that we want it to. Again, we're not going to go live on this system unless it works exactly the way we want it to. We'll be doing testing, substantial testing for approximately 3 months, and then we'll shift into our training phase. Training is going to be a very large lift. This is a new system for all agencies. No one's oriented to it before. And we have to train everybody from the dispatchers taking the calls to the officers, the medics, the firefighters responding to the calls. We have to teach the people who are supporting those responders. And we have to do it in a pretty small time frame. We have about 2 months to get that done. And we have a lot of people to train. Luckily, we're working with regional partners to make sure we have the resources to do it. And then our go live, which is the best date on here, is going to be September of 2025. And what's actually, right now, we're looking at September 9th of 2025. That still has not changed. When we started this project to today, we're still on track to hitting that goal. So the key takeaways from this is that we're on schedule. We're still on budget for the project. We've been assured by our vendor, and we feel comfortable within our own implementation teams that we have the support and resources needed to get this done. And we're excited to go live in September. So I'm here to answer any questions you might have.
Thank you so much. Any questions or comments from our board? Any? I know we have all heard this a couple times. I know that Mr. Driscoll, you've not, so if there's any questions, feel free, or catch you on or whatever. I do want to say this is crucially important. One of the things that the goal of this is also to remove any duplication of needed to get information from our people. I want to say that everything we're doing is trying to slim and trim this down to make it as fast and approachable as we can. I appreciate your hard work, and just for all of us to know this is just a presentation. There's no voting on this. So thank you so much. Anybody online want to have any questions or like to say anything? Dr. Denko, Ms. Garcia?
No questions. Thank you.
Okay.
None for me, Mr. Chairman.
Thank you so much. Have a good one. We're moving on to 11A, and where REMSA is going to bring up their Regional Emergency Medical Services report.
Good afternoon, Chair Madere, members of the board. I'm Barry Duplantis, CEO and President of REMSA Health, for the record. I understand you have been provided with a copy of REMSA Health's September report. For September and for the fiscal year to date, REMSA Health has exceeded franchise compliance responses with all priority one calls in all franchise zones. And in fact, we're at 91% in Zone A and 95% compliant and relative to the 90% benchmark in zones B, C, and D. During the month of September, we responded to 8,192 priority one calls and transported 5,180 patients to area hospitals. And the one thing I simply want to comment in this regard is that when you just kind of put this in perspective, I'm going to ask you just to kind of visualize this. That's 173 patients being zipped away for emergency care per day in our community. That's a lot of trips, a lot of people being taken to the hospital. So I just kind of put that out in terms of perspective of the magnitude of transports that we do in a day. With our customer service survey that we publish each month, we have a score of 90.89 for the month of September. And then the last thing I wanted to comment on is that we're currently in the process of doing our audit, much like your own cities are doing, and we will be providing our audited financial results to this organization in the month of December. That said, I am here and would welcome any questions that you might have that I can address for you today.
Are there any questions? Yes, sir. Mr. Brown.
Barry, under the exemptions, I noticed there was 86 exemptions under declared emergency. Was that during the Davis fire?
Yes, it was.
Okay, and that 86, was that 86 calls that you had the exemptions called on? Because I'm just trying to figure out, was that because the fire departments were tied up and the dual response issues didn't work out, or did you have that many ambulances committed to the incident?
It was a number of things related to the fire. In fact, that, we had some units dedicated to the fire, and so there were a number of things happening all at once. But yes, fire-related. And to that point, Mr. Brown, the one thing I will share is that at the very beginning of that fire, when there were a number of patients that needed to be moved out of a ventilation center up on Montrose Highway, I have to be candid and tell you the collaboration for which all of the agencies, including the VA, who we normally don't work with on a day-to-day basis other than to transport their patients. Everyone came together on very short notice to transfer patients that were perhaps at risk. And that was an incredible thing to see because they weren't ordered to do anything. It was just a matter of we have a need, and all of these organizations came together and moved every single one of those patients. And that was done without taking any of our EMS resources out of the system. So that's probably, I guess, in short, that's what I think made it so incredibly profound for our community, is the fact that we took care of these patients without impacting our 911 responses.
I'd just like to add to that and just recognize Andrea Esp and Jordan Marchifor, who were key, very strong points of that. They were part of the incident command system, but they helped coordinate that, and we're very grateful for that partnership and responding. And I'd like to mirror Barry's sentiments, or Mr. DePlanta's sentiments, that it was great to see that came together and everyone responded, and it was amazing, and it was good to see that response from the community at that time. So I'd like to thank staff for their excellent work on that.
Mr. Chair.
Yes, sir.
Thank you so much, and I'll be brief, except that I'm not sure. Have we opened items 11A and B at the same time, or are we just?
Just 11A.
Okay. So with regard to the monthly reports, I want to just say a couple of things. First of all, Mr. Duplantis, I am incredibly encouraged by the depth of the data that you continue to provide, meaning that, there's a lot in here. It is somewhat wonky at times, but I appreciate the transparency that REMSA brings to the reporting. I have been someone who said from this dais that I don't necessarily want to see the reporting all the time, but I read it. And so, meaning I don't necessarily like dragging you up here every time. And maybe we'll work on that. But what I will say is that for the public, they continue to receive incredible value from the service that REMSA provides. And there are so many stories, and whenever I encounter people in the public who've had any interaction with REMSA for whatever reason, oftentimes it's life-threatening, they are singing your employees' praises. They are talking about the ways in which you have gone and your employees have gone out of their way to comfort the people who have lost loved ones, help the people who are grieving, get people to the care they need. It's often an interesting thing because your folks have to show up and enter into someone's home, which is a very sacred folks for most people. And what I hear from people in the community is that your folks are just very gracious ambassadors for the delivery of the emergency medical care that you provide. So thank you for that. I will also say that I've had the opportunity recently come out and sit with the REMSA folks, some of the board, and just always learning more about the unique role that REMSA plays in our community. And I appreciate that as well, because from my perspective, I don't have the experience and skill of, say, Mr. Brown, who has a lifetime of experience. I have to come at it from my positionality. So the opportunity to learn about what REMSA does, you've been very gracious in allowing me to come along and understand it. I learned a bit more recently about air ambulance and transport services. I certainly have learned about the skill that your board exhibits. It's one of the boards where people are very enthusiastic to serve on it. They are people who are all incredible professionals and really giving back of their time and service. So I commend you for your leadership and also for the board in working through all of the issues that face REMSA, which are complex. I think I had some, we'll say very specific and direct comments about my thoughts about REMSA, about the future of medical transport, and you all were able to answer my questions, and so I appreciate that very much.
Thank you very much, sir.
So Mike Brown brought up the 86, and that's part of, and I say this for the future, and I know we are talking about something we just talked about, but I think it has to do with very thing we're talking about here, so I don't mind throwing it there. Will this, like the 86, will that be explained better when Hexagon is in place, that kind of thing? So we'll know exactly what. So when we say, oh, this happened or this happened, I mean, we just have to take and say, oh, 86. I don't know what that 100% means. I know the Davis fire, without question, people were sacrificing all over the place to make sure that our community was safe, and REMSA's just right there, and I think that's fantastic. So that's not the question I have. But at the same time, it's important we understand it, so when we say yay, nay, we met everything, we can hold, in a sense, accountable, but also help protect you. And if anybody ever comes and says they did or didn't, then I can say, no, this is what happened, or this is, I can't necessarily do that based upon just giving us a number. And so that's something that I know up as we walk into Hexagon, it'd be good to understand a little bit more if we see that kind of explain. Does that make sense what I'm asking?
Yes, it does. In fact, I don't want to overpromise what Hexagon can do, but certainly having the ability to have better visibility to the data of inbound calls, because particularly when we deal with things such as fire, it's not uncommon for multiple people to report the very same fire, the very same incident, which obviously creates a system overload. So we will have better visibility of data and better understanding of what is coming into the pipeline. And then from there, how resources are deployed and what resources available. I think that, it certainly poses a secondary question for us to be able to understand and maybe look at how we report the resources we have available and where they are, and what could we do differently in future events.
As much as part of it, I do get that this is a lot of information, as Mr. Reese, I made you a doctor there, Mr. Reese mentioned, but it's one of those things that part of the reason we gather this information is to help understand what you're doing, make sure the franchise is fulfilled, but also to protect. If we know what's happening, if somebody ever says, you guys did this, we can say, no, we know what's happening there. So those kind of things are helpful. So thank you very much. We are needing a motion on this.
Make the motion to accept as presented.
I do have a first and a second. Any more discussion? Hearing none. All in favor?
Aye.
Aye. Aye.
Passes unanimously. Very good. We're on to 11B, and Andrew Esp is going to come up, and this is discussion and possible approval of the operational review of the amended franchise agreement for ambulance service during the 10-year of its term.
Yes. Chair, members of the board, Andrea S. for the record, Program Manager over Public Health Preparedness and EMS Oversight. I do want to explain a little bit about this report. This report outlines an operational review of compliance by REMSA Health since the inception of the 2014 franchise. There has been confusion on what this report was supposed to be, and so I want to provide a little bit of clarity in how we came to the development of this report. In January 22 of 2015, a compliance report was presented to this board for FY24 that was finishing up the old franchise of which REMSA Health operated under. At that time, it was asked that the program come back and provide an audible checklist on how to basically audit the franchise and the compliance of REMSA Health. The program did come back on June 25th of 2015 and presented a compliance checklist to this board, of which the board did approve moving forward. You'll see I have outlined chronologically in here each time the program brought a revision to a checklist in which the board approved revisions, and that often was revised to provide more clarity and improve documentation of which we collected. And then when the board approved the report annually. So every year, the program brings an annual report to the board outlining the compliance for the franchise. Every year, the board, since 2014, the board has approved the annual report and the information that has been presented in it. Of course, there's been some years where a few questions have come up. An item was maybe not met at 100%. However, that is not outlined how, if anything, is weighted in that checklist. So it's something that we have on our docket to review in the future. So for this, the review during the 10th year, so it's not 10 years worth of data, it's during the 10th year, the program suggests or recommends that the board approve the operational review for Remsa Health. And I'd be happy to answer any questions. There are a lot of attachments to this report, hopefully to provide clarity in what was approved in the past and what checklists, most importantly, was used to approve those annual reports.
So I do want to clarify. So this is only for this year. It's not for 10 years, it's for the 10th year.
It's during the 10th year, there's to be an operational review dating back to the beginning of the amended and restated franchise.
Okay.
And so,
So what this pretty much does is it stacks up the monthly
and then
over this
yearly.
last year, and you're giving a report on this 10th year.
It gives you an overview of the annual compliance of Remsa Health since the beginning of the
So
amended
this-
and restated franchise, not just this last year.
So it's over the 10 years. That's what because I was reading, when I read through it, it had stuff from before. Okay, I want to make sure. So it's over
Yeah.
the 10 years, but it's in this 10th year that we look at all of them. And so, and we're looking to see if the franchise agreement was met.
Yes, and that is, this is outlined in Article 2.5, this operational review is to take place. And then, like I said, in 2015, Chair Jung asked for an audible checklist for which we could measure compliance moving forward. And so that is what took place and what has continued to happen annually and then presented to the board, usually in the spring.
So this is a data checklist, an audible by our staff, which is also some of my confusion. So I wasn't here 10 years ago when it was put together, so I've been trying to catch up myself.
Yeah.
And so we did not, it's not us speaking into it, it's just looking at the data of the last 10 years over the audits that have been put together. Okay. Our job as a health board is to accept or not accept or ask questions of this information for the last 10 years. Are there any questions? Thoughts, concerns?
Mr. Chairman, I move to approve the operational review of the amended franchise agreement for ambulance service during the 10th year of its term.
I have a first and a second. Any more discussion? Seeing none, all in favor?
Aye.
Aye.
Any opposed? Passes unanimously. Okay, we're on to number 12. Recommendation to uphold the decision of the Sewage Wastewater Sanitation Hearing Board to approve variance case. Well, I won't go through all that. I'm going to let you come up and do this. This says David Kelly. You were not David.
Mr. Chair, I'm prepared to make a motion
You want to let her do her?
if she needs to.
Don't need to? Okay. Then
I'll
I have a
move to approve
first.
the recommendation.
So I have a motion on the table.
Second.
I have a second. Any more discussion? All in favor?
Aye.
Aye.
Any opposed? That passes unanimously. Okay, we're moving on to staff reports. Air quality management. Mr. 5-Year Francisco.
Thank you, Chair, members of the board. For the record, Francisco Vega, Director of the Air Quality Management Division. I actually don't have anything to add to my report. Just wanted to mention that we do have 3 spots on our Air Pollution Control Hearing Board where the members' terms will be expiring in December of this year. So we will be going out with a press release probably in the next week or two, just soliciting applications, again, looking for volunteers to join our board. So anything that the board can do to help kind of get the word out there and have those members of the public submit applications, I would really appreciate it.
Can you make sure those go out to each city and county so we can make sure we also put that out there? We always put that out there at a meeting and tell people what is available.
Yeah, absolutely. So when the press release goes out, I'll be sure to forward it to
Thank you.
all board members.
Any questions, concerns, thoughts? Well, thank you for the good work. Appreciate it.
Yep.
And we're moving on to community and clinical health services. Come on down, Lisa.
Good afternoon, Lisa Latritz, Division Director for Community and Clinical Health Services. You have my report, and I'm happy to answer any questions. I just wanted to add that we're right in the middle of all of our flu COVID vaccine events. We had a flu COVID pod on October 19th, and then earlier this week we were at the mobile harvest event on Neal Road, and I wanted to thank our health officer, Dr. Kingsley, who was great helping our staff with translation. They were very grateful to have him there. And then we have additional events coming up in November and early December. And I'm
Very
happy to answer any questions.
No questions? No questions? Okay, thank you so much.
Thank you.
And now we have, is Jim English coming down? This is for environmental health services.
For the record, Jim English, Environmental Health Specialist Supervisor, filling in for Rob Fida, Division Director. Have nothing to add to this report, but I would like to take the time to thank this board for continuing to support our nationally recognized food safety program, to be a mentor to Saipan. As you know, they're 17 time zones away, and it is very difficult for them to get the type of mentorship that they need to become successful in the voluntary standards program. So we appreciate this board's continued support for that. Furthermore, I wanted to thank the board for allowing us to continue at the management level to tweak our staffing and positions. I forgot to mention earlier that Millie is actually a reclassified position that went through the budget process that had to be approved by this board. We went from administrative one to a senior office specialist. We think that'll make us more efficient and nimble and provide the best customer service possible. And finally, I'd just like to welcome Mr. Driscoll to this board. Excited to have you on this. I've worked with you in the past. Look forward to that, and I know our division does too. So thank you. I'm available for any questions.
Thank you, Mr. Chair. Mr. English, thank you so much for the presentation and for the materials in the packet. I wanted to focus on one of the comments you made about the staffing and the reclassification of someone, which you hope would lead to better customer service. Is that what you said?
Yes.
Okay. So this is an area where, so I had the privilege of being overseeing environmental health services as a board member for the last couple of years of this body, and it was really enlightening to me. I really enjoyed it. I learned a tremendous amount, and your team was outstanding. Really felt good about the opportunities I had to learn more about all of these subparts. It's a very complicated area because you cover so much, and it seems like there are a lot of moving parts. And so maybe what I'm trying to communicate to you, and I would like to hear your thoughts on, are about a general concern that sometimes is raised, sometimes fairly and sometimes unfairly, about our not being very customer service oriented as an agency. Meaning, you got people out there who have to interact with us, and this is probably in the commercial plan review side, and then the times when people get those plans reviewed over the course of their existence so they can get to C of O. But there is some general sense among certain folks that it's not going very well. And so maybe is it the case that the staffing model that you're talking about is designed to address that? Or is this something like bigger than the scope of what we can talk about today?
I think what you're specifically referring to may be bigger than the scope that I'm addressing today. The position that we reclassified originally was a supervisor position of just our clerical individuals, some of which do touch the plan review process. As you know, our division's gone through quite the reorganization over the past, I would say, about 2 years. Millie's position is actually going to be on the front line, providing the original initial customer service to both our external and internal customers at our front desk, and also overseeing our front desk. And what makes her such a great asset is that all our initial front desk staff members all speak Spanish, and she also speaks Spanish, which is very helpful to have someone in a lead position there. We felt that the roles and responsibilities of that position could be done by a senior office specialist. And as you know, that was a very difficult process because the county just went through that HR Corn Ferry process. So originally, our administrative system and series in environmental health had 3 levels. It had an administrative supervisor, office assistants, and then we had office specialists, those were the individuals that did the very technical programmatic administrative work, like making sure plans that have been approved by field staff have actually been properly processed, the fees attached, and the responsible agencies such as Reno Sparks or Washoe County have been notified that we've done our job. With the Corn Ferry, all our office positions outside the supervisory one were combined into one job class. Made it pretty difficult for how we've operated, and we've had to work through that, and our team is doing a very good job adjusting with that because they've all been lumped into one group. So as part of that review, Mr. Fida and myself looked at some few different options, and we were also looking at how not to potentially have a supervisor over just those administrative positions. And as I believe you're fully aware, the Environmental Health Specialist Supervisory Class Series actually took on all the office support positions to their specific programs, and we've assigned them out. So we have one dedicated to plan review. We also have a backup for that individual, and then others that aren't as well-versed, but we can get them to help through the process if people are on leave. I actually ended up taking over, overseeing the front desk, which has been a very interesting endeavor over the last year and a half, especially since in my job classification, I can't touch money or finances. But with that, we came to the decision that was probably best for our division to come up with the senior position because it would allow them to be a lead over the office specialists, primarily for our front desk. It would take some of the burden off me, and they would also be able to work directly with our customers.
Well, I think you've answered part of my question, and then the other part of my question really was beyond the scope of your presentation, meaning it wasn't that I expected you to have the answer to it, but I thought it was the place where I could ask the question. For my part, and I'll bring it back to the board, I was not able to be last week at a very important meeting that the chair and Dr. Kingsley were at. I had another engagement, so I was not able to be there. But it was a gathering of folks who were broadly concerned about the way in which there is some general malaise towards our review of plans and permitting maybe it's from the industry side of the aisle. And I think that it is worth our time as a body to invest the energy in figuring out what we're doing right and what we need to work on. And if your concern that you've posited through another roundabout way is the staffing model that's preventing some success in that area, I need to know about it, right? Because I can't micromanage, nor would it be my intention to micromanage any of the divisions of the health department. But when the things fall on my shoulders to fix, and then we have to jump through those steps to do it, you don't want that left to me, right? You are the technical experts who have a superior knowledge base. But what I do know is we have to be aggressively looking at what we are not doing well, what we can do better, how we can communicate better with the community that we represent, and making certain that through whatever process and performance improvements we make, if it means staffing models have to change, if it means job duties, classifications, all those things have to be resolved, we have to be willing to serve the customers that are in front of us. And that is really the commitment that I want the public to understand from my perspective as a board member I'm interested in, and also our leadership team to understand that's where I am coming from. That's what I want to take on or tackle or whatever the word is in the coming years, because I think we're close to being who we want to be and being better, but we're not quite there yet.
And I want to thank you, Mr. Reese. I can say that these conversations are ones that we are having. I do want to say, Dr. Kingsley, thank you for taking the meeting with our group of, it was really about pools, is what that one was about. But the truth is whether it's about pools or it's about a restaurant or it's about any of the forms, it is about customer service and how we handle things, because there's some things we can't move. And so this is not really directed at you. I'm just saying at large. You don't have nothing to answer here anymore, but thank you. But I do want the board to know we will chat. Dr. Kingsley will continue to keep you updated on how that is going. I do believe he is taking the task head on. He is willing to meet with anybody who brings up Matter of fact, when someone sends me something, it goes straight to him, and I would encourage you guys to do the same. But he also has responsibility, I believe, to make sure he's communicating to each and every one of you, so you're not in the dark of what he's doing. And
Well, and let me be clear, Mr. Chair, he has absolutely done that. Dr. Kingsley has been very responsive to my inquiries. Oftentimes, it's a matter of just collecting information. I want to make sure that once we've collected the information, we are able to go out and work on the issue to the satisfactory resolution of both of us, not just us as a body, because we have that obligation, but to the customer. I'm concerned. We had a public speaker talking about home-based business and an equine business being required to have a commercial-grade bathroom. That sounds crazy to me. I mean, that is just fundamentally something that I don't understand. You might be able to explain it to me with some analysis and due diligence, and we would get to the same legal place. I am professionally a lawyer, so I understand the rules. But what I want is for our community to know that when they interact with this agency, that their concerns will be seen as valid, that we will work on the things that we can work on. There will be things where we cannot change, alter the rules. That's not the goal, but we have to figure out how to be the best agency we can to make sure that our community is supported from a public health standpoint, from business and industry who are working so hard, home-based businesses, and that's really my expectation.
I can't speak for everybody, but I do agree. So there's nothing there I disagree with. So that is our goal, and like I said, I do believe we are moving forward. I do. I know that one of the things that I'd say is that on this, one of the parts that Dr. Kingsley did well is he brought staff with him. And so this was not just a conversation of talking heads, and I say that in a very beautiful heads we had there, but it had staff there, and staff got to hear and be a part of it, which was good. I do think we're, but I would echo this, and I want to make it clear to anybody that works here, is that this is not something that can be fixed in a year. This is something that needs to be fixed immediately. This is something we want to have the best front face that we can. So, thank you. Oh, without question. I think when it comes to skill set, that is not. I think sometimes we go through different things, but we need to be careful when we come back. So, environmental health, I do have one thing I do want to say. You guys just went through event season, because I want you to take back something that, God bless you. I mean that you guys go through so much of all the different events that happen, and you do so much. And I do want to thank you for keeping up with that crazy schedule. I know that with winter coming, you get a little bit of break, so.
Yes, staff will definitely appreciate to hear that, and I'll relay that message. And we're already hearing they're trying to put more events, both. I think Reno and Sparks have a competition of who can shove the most in the calendar, because we just were notified Sparks is going to add quite a bit more in September and August next year.
Yeah, we're going to win. No, just kidding. Thank you so much. We have epidemiology and public health preparedness. Come on down.
Good afternoon, Mr. Chairman, members of the board. This is Nancy Dow, Division Director of Epidemiology and Public Health Preparedness. You have my report. I don't have anything to change or add. Just a few quick highlights for what's happening in October. So in public health preparedness, as Ms. Lautris already mentioned, our PHP team worked with the CCHS team and held a very successful flu and COVID pod on Saturday, October 19th. Also in exercises, this Tuesday, October 22nd, NNPH partnered with the Nevada County Department of Public Health along with various partners and held a cross-border virtual tabletop and functional chem pack exercise. The aim of this exercise was to really enhance preparedness and coordination among regional emergency response teams in addressing hazmat incidences where there's a required deployment of chem pack resources across state lines in a response to a chemical incident. So multiple Nevada agencies participated in the exercise, including State Department of Emergency Management, Nevada Department of Public and Behavioral Health, State and Reno Police Department, REMSA, Fire Agency, and Washoe County Sheriff's Office, just to name a few. And participants really engaged in scenario-based discussions and simulations to kind of identify critical actions for effective response, and including of looking into communication protocols, resource allocation, and interagency collaboration. So it was a very successful exercise and really helped strengthen relationships among our agencies and improve operational readiness. And in epidemiology, this month, we published our quarterly communicable disease reporting and statistics for the third quarter of 2024. This series covers tables and figures that compares reported morbidity for selected communicable diseases during the most recent quarter in comparison to historical morbidities reported over the previous 5 years. So increases we're seeing in this quarter of 2024 compared to previous years in flu A, but with small numbers, and decreases in RSV, COVID, and primary and secondary syphilis were captured. Also, flu season has officially started with MMWR Week 40 on September 29th. So this season, we've started the publication of our weekly respiratory virus surveillance report covering influenza, RSV, and COVID-19. So currently, LI activities remain low and below baselines for both Nevada and Region 9. Flu hospitalizations and RSV also remain low at this point. The majority of our flu sequencing are showing flu A, H3 sublineage so far. COVID cases and hospitalizations have also continued to decrease in trend since week 36. So all these reports are published on our respiratory virus surveillance program page, which is new for this season on the NMPH website, and also send out to our listserv. So if you would like to be included on our listserv, feel free to reach out to an epidemiologist or to myself, and we'll have you added. So that's all I have for my update. I'm happy to answer any questions.
Any questions? My only thing to you, thank you so much for the information, but Dr. Nancy Dow, I want you to meet Commissioner Driscoll. He's going to be the one hanging out with you a little bit. So when this meeting's over, if you don't mind connecting with him, because he'll be the board member that he does have some background. I remember one of our big floods, he was leading that right in the middle of Sparks. So he has some background in that, hands-on, the real thing. So I think he'll be a big help, but also a place to learn what you guys are doing.
Welcome, and happy to work with you.
Dr. Dow, just a couple of questions. So first of all, I would like to be on whatever the listserv was that you were going to offer. So please,
respiratory virus.
Yes, that would be great. And I hope everybody else has had the opportunity to, if they so choose, but I've gotten my flu shot, my COVID shot. I also, because I've now entered the over 50 club, very recently got shingles shot. So I'm excited about that. I read just this morning about maybe some new changes in guidelines for the age for folks to get pneumococcal pneumonia shots. Used to be 65 or
Wow.
Well, I don't know if I'm saying that right, but I was interested to know if your reports track that. Or that's not?
That's not on a respiratory disease, but I can get you more information and send that to you.
Okay, yeah. And is it the case that they are lowering the age for it? Do you know, or is it just in the discussion stages?
I believe right now it's still in the discussion stage, yeah.
And also, I wanted to just ask, I thought the information contained in the report was quite thorough. What is your best understanding of where we're headed with both the COVID and flu season? Did we get through a big patch of it this summer when people were like hanging out together, and we're now entering a different period? I've read something about that as well. What can you tell me about that?
So flu has settled into a pretty regular pattern from year to year, always during the winter sessions around late November, December, and your early January is when we see that surge. COVID is something that's still settling in the recent past 3 years where we had COVID. It's been a peak that's been happening over the years. So we get a summer surge and then we get a winter surge. Oh. So we did just go through our summer surges where our cases have been averaging, for the ones reported to us, about 50 to 60 cases a day. Right now we're down to about 11 to 15 cases a day that's being reported. We are aware that coming in November, as the air gets a little colder. Also, drier air helps respiratory virus propagate a little further and faster. And people gather indoors along with each other with all these family gatherings coming up with Thanksgiving, with Christmas, that it could be surging again. So we do encourage people to get your shots, even if you already had it. COVID seems to fall into every 6 months it does do a surge, and flu seems to be one surge a year.
Okay, thank you so much.
Yes.
I'd just like to make a comment, and this is just really point out what is public health on many points. So when we review this data, it also tells a story that's not there, and that story is what is public health is prevention. So when we see we're in the green, and we see perhaps in other communities are struggling with other points, we've done something right here. We've prevented something. And so a lot of this is saying that as a community, we're doing that. Just an example is pertussis is in the news right now. That's whooping cough, but we don't have an outbreak here. So, it's almost, I'd like to, commend both our nurses and that deliver our Tdap vaccine for pertussis or whooping cough, but also we're not seeing it here in our community because our community prizes to be healthy on a lot of these points and does those things to prevent it. And that prevention, a lot of times we don't get recognized for it, but it is a great opportunity to do that. And a lot of our greens here is because we've done the work out there and our community's done the work. So I just want to recognize that story that's there. So,
Thank you so much. Thank you.
Thank you.
We're moving on to you, sir. District Health Office Report. What you got, sir?
Let me pull that back up. Sorry, I know. Oh, there we go, agendas. There we go. And let me down here. There is just nothing to add to the report. Just again want to recognize staff and their wonderful service that they've been providing. And my attachment's not on here. I just wanted to recognize in my report, oh no, there it is. All right. There are just two things that is part of my position. There were just two authorizations on there, just a committee within our organization. We put together of our team members, both for equity and recognition and better language for our parents' policy. They spent the time, and it was taken from all levels down to staff just to review it, to provide a better equitable but also representative type of appearance policy for our staff. We have brought that. It will be brought to the employee handbook, which is updated once a year, but just wanted to put it out there. So we're kind of in the pilot phase. It's approved, but it ultimately is not approved until we bring it to the board, but that'll be coming in August. But there was some great work there. And then just another, we just had a change in a vaccine that was added, a different fee schedule, which is in my authority granted me from the board. I just wanted to recognize and put it in there as a small change, just needed for part of our fee process there in community and clinical health services. But other than that, any questions on my report? And I'd also just recognize that we have for our Public Health Advisory Board accreditation that has been submitted, and everything is looking great. We're just waiting to hear back from them. We'll just have our site visit, and we should get reaccredited. So we're just on that process. So, but all has been submitted and great. So thank you.
So my only question on accreditation is I don't think any of the board has had anything to do with it, which I thought that was part of the process. Is that not part of the process?
It is part of the process, yes, and I believe there were surveys and various, and I'm not, and so I would refer to Ray on this just because I'm coming in towards the end of this, but I do believe there has been a process, but this also been over a 2-year process, so maybe previously it was there and it was part of it, but when they come for the site visit, I do believe you are involved as well.
Okay,
Yeah.
that's cool. Not complaining, I'm
No.
just saying, I thought we were part of it, and I know no one's talked to me, and I don't think anybody's talked to our board. So, okay, we are going on to now board comments. Do I have any board comments? Mayor Luce or Dr. Denko, do you guys have any?
I do not, thank you.
None for me.
I have one, and it's something that we've talked about, and it's came out when I watched our last meeting we just had. It came to my mind. We've been talking about getting us some numbers on permitting and how long it's taking, and if there's something behind. I know we've had a lot of different conversations, but I'd like our board to be able to see that. If we
Okay.
could have that, maybe presentation, how that's going, that kind of thing, so we can understand some data behind some of the conversation.
Great. We'll bring that forward to you. Thank you.
Thank you so much. With that said, we are adjourned.